Okay, so let's go in and discuss the skeleton. This material that I will be covering will be on your second lab exam. Predominantly, the second lab exam will be the skeleton. In fact, that's what I shouldn't say predominantly. It'll be solely on bones. So some of the materials. So we're going to start to kind of cross back and forth between lecture and lab. So let's start off with the skeletal system here, and we'll go into some more of the details about the bones and whatnot. Whoops, let's go back here. Okay, so when we're talking about the bones of the skeleton, and folks, a lot of you know just from just common sense, really what our skeleton, its function is going to be. And I talked a little bit about the function of bone when we were talking about connective tissue, but it's going to give us one, form and structure, right? It allows for attachment sites for other tissues like muscles, for example, right? We notice that it's going to protect some of the internal organs, right? Movement, obviously, through the contraction of skeletal muscles, but they act as levers there. And not important, but I always find it's an interesting, and there have been test questions that have asked this before, right? How many bones are there in the body? And there's 206. So we're going to discuss all the different types of bones, the different shapes of bones, and you'll notice when we start to go through this, and hopefully you'll gain an appreciation of, as we move through this chapter, that appreciation of why a bone looks a certain way and where it's located. And that itself will help you to understand a little bit more on the basics of skeletal anatomy there. So as we go through this chapter, we're going to be seeing bones, and then the structures on the bones, or the anatomical landmarks, but also what we call bone markings. So one of the things I do want to recommend to you folks is when you're studying this chapter for lab, that you really take the time to know the bones. And when I say know the bones, like if I were to hold up a bone in front of you and I say, what bone is this? You could say, oh, that's the femur. Hold up this bone. Oh, that's the zygomatic bone. That's what you should be focusing on first before you learn all the bone markings. Okay, so ideally, if you want to try to make this as simple as possible for yourself, learn the bone, be able to identify the bone, and then you can learn what's on the bones. All right, so these bone markings are going to be these different features that we'll see on these bones that are going to give certain characteristics. And so you're going to see how, for example, on some bones there, you might notice some smooth areas there. And so those areas on the bone are where we're going to see articulation or connection to another bone to form a joint. In some bones, you might see a hole, an opening, a groove or whatnot. And so we'll see that maybe something passes by, or if it's a hole, something will pass through that. And on other bones, you might see a part of the bone where there's a little bit of a bony projection that's coming off. And that's usually going to be where things attach onto that bone. It could be a ligament, it could be a tendon, all right, it could be skin. So this figure here, 8.1, I really encourage you to go back into your book and look at, one, the anatomic term. And if you're into flashcards, on one side of the flashcard, you can put anatomic term, and then on the other side, you can describe whatever that anatomic term is. Perfect example is foramen. So what's a foramen? All right, a foramen is a rounded hole or passageway through a bone, and that's going to be for blood vessels or nerves. So when I say foramen, you should be able to automatically think, okay, that's a hole, right? A fissure. Again, it's going to be another opening in a bone, but in this case, it's slit-like. So when you're looking at some of these structures and you're trying to figure out, right, what it is that you're looking at, if it looks like a slit, then you can say, oh, that looks like a fissure, and then maybe that might jar something in your memory. Oh, that's the superior orbital fissure or the inferior orbital fissure. All right, so all these different structures on the bones here and these bones, we're going to be able to identify. So when we study the skeleton, we break it down into two divisions. We have the axial skeleton, and we also have the appendicular skeleton. The axial skeleton is going to be made up of all the bones that form your central axis of your body. So that's pretty much, when you look here, the skull, the vertebral column, and the thoracic cage. That's this guy. Everything that's in teal, that's your axial skeleton. So there's the skull, there's your spine, your vertebral column, and then your rib cage, including the sternum, the bone in the front there. So that's pretty much the central portion of your body. And so its job mainly is going to be to create the framework and structural support, all right, that is going to allow the appendicular skeleton to connect to, but also, right, if you notice, you can see the skull and the spinal cord. Well, that's going to house your central nervous system. So they offer a protective function. The rib cage helps to protect the lungs, excuse me, in the heart underneath. So predominantly, the axial skeleton is going to offer that framework system that helps to protect the underlying organs there. And we talked briefly about it when we were studying the spongy bone. We talked about how with spongy bone, we have our bone marrow there. And the bone marrow is the tissue that makes your formed blood elements, which are erythrocytes, those are the red blood cells, the leukocytes, those are the white blood cells, and our platelets, right? So that tissue that we find in the spongy bone and the axial skeleton is going to primarily be the hemopoietic tissue. All right, the other division is going to be the appendicular skeleton. And that's basically going to be your upper and lower extremities or limbs and the bones to which they articulate or form a joint with. So how do we hold our upper and lower extremities onto the axial skeleton? And so the bones that allow for that to happen, we refer to them as girdles. And so if we're talking about the upper extremities, then we're referring to the pectoral girdle. If we're talking about the lower extremity, we refer to it as the pelvic girdle. And so it's those structures that allow us to attach the upper and lower extremities to the axial skeleton. So you can see here in this picture, all those bones of the appendicular skeleton are shown in teal. And notice, yes, it includes your arms and your legs, but it also includes your pelvis, or not, excuse me, your the pelvic bone right here, the os coxa, because that's what it's allowing the lower extremity to attach onto your axial skeleton. And then we're talking about the upper extremity. We notice we have the clavicle or the collarbone and your shoulder blade, the scapula. Both of those bones, all right, allow us to attach our upper extremity to the axial skeleton. We'll talk more about that in detail here. This picture right here is just showing you the bones that make up, all right, which divisions of the skeletal system there. So what is the general function of the axial skeleton and what bones are considered part of the axial skeleton? It creates a framework that supports and protects organs. Okay, it's the skull, the vertebral column, and the thoracic cage. So what I'd like to do now is start off by talking about the skull. The skull is often considered to be one of the hardest structures to learn because of all the complex bony landmarks, the nooks and crannies, all the bones that comprise the skull. So that's why we'll start off with it first. Start off with the hardest one. All right, so there's 22 bones that make up the skull, and we divide the bones of the skull into two divisions. We have cranial bones and facial bones. Facial bones is pretty self-explanatory. That's going to be all the bones that make up your face. The cranial bones are going to be all the remaining bones, but those are going to pretty much be the bones that make up your skull, the area of the skull that houses your brain. All right. So all these different views, it's important that you're able to understand these different views, all right, when we're looking at these pictures here. So I'm going to quickly review this view of the skull here in the top left corner. That's the inferior view. We're looking up at the bottom of your head. The one in the middle top is going to be the anterior view. The one on the right, the top right, that is going to be the lateral view. Bottom left, that's the posterior view. Bottom middle, that is going to be the superior view. And then this view right here, where we've cut open the skull and we're looking at the inside, that's a sagittal view. So now we're going to go through each of these different views, and I'm going to go over and review with you what structures that you can see in these views, and then we'll see them in some pictures too. All right, so we're going to be bouncing back and forth through quite a bit. So let's briefly describe the cranial bones. All right, again, pretty much when I was describing to you what the cranial bones are, they're going to be the bones that make up the part of your skull that's going to surround your brain. So we call that the cranium. And so the top of the cranium, if we were to literally saw off the top of your head and remove the top of your head to look down inside at your brain, all right, that part that we remove is called the calvera. That is the roof of the cranium. And that's going to be made up of 4 bones. You have a frontal bone, obviously that's in the front. The occipital bone is in the back. And then you have 2 parietal bones, the left and right parietal bones. Those are the bones that sit on the top of your head, but off to the sides. So we'll be removing parts of those bones. Now, when we take the calvera off, we're looking on the inside of your skull. We see the brain there. If we were to lift the brain out, it would expose to us the base of our cranium. And so that's made up of the ethmoid, sphenoid, occipital, and temporal bones. Don't worry about that. I'll go through that with you. All right. But it's just kind of to give you a decent idea of those bones there. All right, so here's the picture that I'm talking about. Okay, to our left is the calvarium, and you can see here, all right, it's made up of 4 bones. 1, 2, 3, 4. Here's the frontal bone. These are the 2 parietal bones, and then the occipital bones here is on the back. So once we took that off, normally the brain would sit here. Once we pull the brain away, then we can see all the other bones that are left behind. So you have your sphenoid bone again. I'll go through a lot of this stuff. Sphenoid, ethmoid, the temporal. We got part of the occipital back here too, okay? But we'll go into more detail about that later on. All right, so that's the cranial bones. Your facial bones, like I said, those are the bones. Look at the word there, the name, all right? They make up your face. And so they offer protection to the openings to your respiratory tract and your digestive tract. Well, that's going to be your nose and your mouth. And of course, everybody's facial bones are going to have some similarities, right? But there's going to be several differences, obviously, because we don't all look the same. So we will have some individuality from person to person. So these bones are going to create these cavities, all right, that you'll see. The opening, for example, to your eyes, those are called the orbits. And then the opening to your nose, all right, that's called the nasal cavity. So let's take a peek here. Here is a picture, all right? When we talk about the facial bones, we have 14 facial bones. And so we're going to talk about all these bones here that make up your face. All right, so obviously the facial bones, all right, you'll notice, all right, we talked about briefly when we were talking about muscle tissue and how they have attachment sites for muscle tissue. Well, the facial bones provide attachment sites for two types of muscles: muscles of facial expression and muscles that you use to chew food with. And so we call those muscles of mastication. And if you look here, you can see that with some of these bones, you have paired bones, which means you'll have a right and left one. And then we have unpaired bones. So we'll go through all these. I'm not going to read those off because they're not going to mean anything to you. Okay, so we talked about the bones that make up the skull. And so our skull has several cavities. And so I want to go through those. The largest cavity is where we keep our brain. All right, that is our cranial cavity, also known as the endocranium. For obvious reasons, all right, the bones that surround that cranial cavity are going to offer protection. But also, okay, tissues that surround the brain will attach to those bones, and so they'll offer some support to the brain. A couple other cavities where we keep our eyes, we call those the orbits, right? Your nose, where the opening to your nose is, and there's the cavity of your nasal cavity, which is right in the center of your face, essentially. Your oral cavity, your mouth, and then you have these fellas, the paranasal sinuses. For those of you that suffer from allergies, all right, and are subjected to hopefully infrequent sinus infections, these cavities are the ones that are responsible for a lot of that. So if you notice here, our paranasal cavities are pretty much like the name says. These cavities are going to be around the nasal cavity. So your nasal cavity is pretty much going to be everything here in yellow. So everything around the nasal cavity, that includes the frontal sinus. So if you ever get like a headache or pressure in between your eyes, it's because of the frontal sinus. On either side there of the bridge of your nose, you have the ethmoidal sinuses. And then by your cheek, you have the maxillary sinus. Not too long ago, I had a sinus infection, and that cavity on my right side got so full that it was putting pressure on the nerves to my teeth. So my upper and lower teeth on my right side were painful and numb, because that's how full, all right, the maxillary sinus got. It sucks. I don't really get sinus infections, but it happens. Okay, so we got all that other stuff out of the way. I want to start to move through the different views of the skull. So we're going to go, this is a frontal view right here. So we're going to start off with the anterior view of the skull. So the predominant superior bone on the frontal view is going, or the anterior view, excuse me, is going to be the frontal bone. That's the bone that makes up your forehead, and it goes up past your hairline. So it almost goes up to the top of your head. All right, so the inferior portion of the frontal bone is going to be the top portion of the orbits there. And so in the orbits, your eye sockets, if you may, you will notice now, one thing I need to say is the orbits aren't just found in just one bone. You have several bones that make up the orbits. The frontal bone just happens to make up the majority of the superior portion of your orbit there. So if you look in the orbit, and I'll show you this in a moment, you'll see these slit-like structures, all right, that almost makes it look like a V on its side. So here's an orbit. And if your nose is over here, you'll have one slit-like structure going this way, another one going that way. So the top one is known as the superior orbital fissure, and the bottom one is known as the inferior orbital fissure. It's a slit-like structure. It literally looks like, all right, like a crack, like that. So fissure is a great name for it because it makes sense. Now, the frontal bone makes up the top portion here. Well, on this region here where your eyebrows sit, right? That part of the frontal bone is known as the superciliary arches. And that's much more pronounced in males, and it's even much more pronounced in folks that have Down syndrome. And so that's one of the identifying factors that you can tell when you look at somebody with Down syndrome. You'll notice that they have really pronounced superciliary arches. So here you can see, here's the frontal bone. And so the inferior portion of the frontal bone makes up the superior, the roof of the orbits here. All right, so here are your orbits. Then you'll notice you have these two slit-like structures, one here, one down here. We'll zoom in. That's the superior orbital fissure up here, and then down below is the inferior orbital fissure. And then right here where you have those kind of raised, all right, I'm not going to call it projection, but it's just where the bone kind of comes out a little bit. That's the superciliary arch. A couple other things you'll notice on the anterior view. We have one of our one of our paired facial bones. Those are called the nasal bones. They make up the bridge of your nose. And just above where the nasal bones meet is this area called the glabella. So if you feel the bridge of your nose and you immediately go above that, pretty much in between the superciliary arches, that's the glabella. Now you have another bone, okay, on the anterior view, and this makes up the upper jaw. So where your top teeth, right, where they insert into the bone of your top jaw there, right beneath your nose, that bone is called the maxilla, and you can spell it just like it is there in bold, or you can call it the maxillary bones. But this makes up your upper jaw. It also forms the roof of your mouth, but the floor or part of the floor to the orbits there. And you'll see when it curls up to form the floor of the orbits, it's going to form the lateral portion to your nasal cavity. All right, real quick. Here you can see the nasal bones. Right here, it's paired. So you have a left and a right nasal bone. Right above it, here's the glabella. In between the superciliary arches, here and here. And then you can see the maxillary bone or the maxilla. See how it forms the lateral boundaries here to the nasal cavity, forms the top portion of your jaw. So therefore, it forms part of the roof of your mouth. And then it forms part of the inferior portion or the floor here of your orbit, here and here. And it forms a little bit of your cheek, part of it. All right. Two other structures I want to point out to you on the anterior view is the nasal septum. Some of you have heard about that. You may have heard of the term deviated septum. And basically, the nasal septum divides your nasal cavity into right and left halves. Part of the nasal septum is made up of bone. Part of it is made up of cartilage. You don't have to worry about the cartilage part until next semester, until 211, okay? But there are two bones that make up the bony nasal septum. We'll review that. Then also in the nasal cavity, you have these two bones, all right, that appear on the lateral boundaries or the lateral walls of your nasal cavity, and they look like wrapped up scrolls. So here's your bony nasal septum. Okay, here's one lateral boundary to the nasal cavity. Here's the other. And then coming off of those, you have these scroll-like bones here and here. Those are called the inferior nasal concha. And so their job is to help create turbulence as you're breathing in. All right, it helps to swirl the air around for several reasons. Help to clean the air and help to humidify the air, and it helps you with smelling. All right, so here we can see, here's your nasal septum right down the middle here. And then on either side, all right, you'll have these little bone-like projections, and those are the inferior nasal concha. All right, so let's move on to another view and let's look at the superior view. All right, so the superior view, like I said before, when we were talking about the calvarium, all right, we chopped off the top of your head essentially and lifted it off. All right, so it's made up of 4 bones. All right, the frontal bone in the front, the 2 parietal bones, left and right, and then the occipital bone in the back. Now, when bones come together, or excuse me, when cranial bones come together, they're considered to be a flat bone. All right, they will form a joint with one another, and we call those suture joints. So we have a couple suture joints that we're going to talk about. The coronal suture joint is going to be the joint in between the frontal and both the left and right parietal bones. The sagittal suture joint is just going to be where the left and right parietal bones come together. There's a third suture joint, since we're talking about all the bones on the superior view, that is found in between the occipital bone and both the left and right parietal bones, and that's called the lambdoid suture. So just to show you, here's the frontal bone, here are the left and right parietal bones, here's the occipital bone. So the joint in between the frontal and the 2 parietal bones, this is the coronal suture right here in the front, which is nice because the coronal suture is in the coronal plane. Remember, the coronal plane is going to divide the body, or whatever structure it is that you're looking at, into anterior and posterior portions. Our sagittal suture goes right down the middle here, and it divides the left and right parietal bones from one another. And this last suture down here, that is the lambdoid suture, and that's going to divide the parietal bones from the occipital bone back here. All right, that's the superior view. Now let's do the posterior view. So this is the view that I'm looking at when I'm standing behind you in line. So the posterior view is going to show the occipital, the left and right parietal bones, and we haven't talked about the temporal bones, but those are the bones that are on the side of your head. Basically, your ears will sit on top of the temporal bones. So we'll see a couple of the suture joints here also. So when you're looking at the posterior view of the skull, you'll notice a bump right on the back of your head. And you can actually take your hand right now if you want to. You can play along. Everybody's invited. And you can feel on the back of your head, you'll feel a bump back there. I'm actually doing it right now. All right, that is referred to as the external occipital protuberance. Protuberance is a bump. Occipital is telling you what bone it's located on, and external, it's telling you it's on the outside, because you also have an internal occipital protuberance on the inside. And it's going to be, you guessed it, on the occipital bone. And then we'll notice these structures, we call them superior and inferior nuchal lines, but they will sit, all right, on either side of the external occipital protuberance. And those superior and inferior nuchal lines are sites of attachment for structures that come from your neck. You have a ligament, it's called the nuchal ligament, that attaches onto, all right, the posterior portion or the occipital bone there. I'll show you a picture here in a moment. Okay, so here you can see, all right, here is the parietal bones, and you can barely see a little bit of the temporal bone here on the posterior view, obviously the occipital bone. So here's the lambdoid suture right here. And lambda is a triangle. So this is almost like a triangle. Then you have your external occipital protuberance, that bump right here. And then on either side, you'll have the inferior and superior nuchal lines. And that's what this guy attaches onto, the ligamentum nuchae. And other muscles and tissues will attach onto that portion. All right, let's look at the lateral view here of the skull. The lateral view is going to include only one of the parietal bones, your temporal bone, and the zygomatic bone. The zygomatic bone is one of the bones that helps to make up your cheek. We'll also see, all right, the maxilla, which is half of, well, it's that bone that makes up your upper jaw, your mandible. We all know that's your jaw, the movable portion of your jaw. And then we'll see parts of the frontal and occipital bone. All right. So the three highlighted structures here are the lacrimal bone, the zygomatic arch, and the temporal mandibular joints. The lacrimal bone, I want you to think, when you hear lacrimal, think of the eye. You have a lacrimal gland. That's the gland that produces tears for your eye. So the lacrimal bone is going to be found on the medial portion of your orbit, right? And it's just posterior to the maxilla. Let me show you. Whoops, wrong way. So here on the lateral view, remember the nasal bones? Those are the bones that make up the bridge of your nose. They're the most anterior bone of your nose, right? You have your nasal bones. And then this bone right here is the maxilla. Here's the maxilla, all down here, and it goes up to here. Then the lacrimal bone is right behind or posterior to the maxilla. So it's going to be in the orbit here, right? The zygomatic arch, the only arch, you literally have an arch in your skull. And so it's made up of two bones. It's going to be made up of part of your temporal bone and part of your zygomatic bone. So we'll look here. All right, well, hold on. There it is. Here's the zygomatic arch right here. And you can really appreciate it. See how it's a nice arch-like structure? But it's made up of two bones. It's made up of part of the temporal bone, which is the posterior portion of the arch. And then the anterior portion is part of the zygomatic bone. So when we're talking about the whole arch, we're referring to it as the zygomatic arch. If we're talking about the posterior part, then we call it the zygomatic process of the temporal bone. So we name the process after the bone to which it's going to articulate with. So this bone, this part of the arch is from the temporal bone, but it's articulating with the zygomatic bone. So we call it the zygomatic process of the temporal bone. This part of the zygomatic arch, okay, it's part of the zygomatic bone, but it's articulating with the temporal bone. So it's the anterior portion of the zygomatic arch. So we call that the temporal process because it's articulating with the temporal bone, but it's the temporal process of the zygomatic bone because it's part of the zygomatic bone there. And then the last one here structure is the temporal mandibular joint, also known as the TMJ. Some of you have heard that before, but in a different context. You may have referred to it as the TMJ when you're referring to some issue that you're having with your jaw. All right, but actually it stands for temporal mandibular joint. So when people say to me, and I don't really say this, but I've always wanted to, when someone says, oh, I've got TMJ, I said, yeah, I've got two. I got a left and a right one. I've never done that. I think I might do that. All right, so here's your temporal bone on the side. And then you can see it in relation to the parietal bone right here. This is the frontal bone right up here. Here's the occipital bone back here. To review, there's the lacrimal bone. And then we got a new bone here called the zygomatic bone. So the zygomatic bone makes up part of your cheek. All right, staying on the lateral view, all right, we're going to be seeing a couple other structures that are going to be on the temporal bone. You have the squamous part of the temporal bone. Well, the squamous, remember what squamous, when we were talking about squamous cells? And what did a squamous cell look like? It looked flat. So this part of the temporal bone is just a flat surface. Then in the temporal bone, you'll notice a hole. Remember what I said that sits on top of your temporal bone, your ear. So this hole is the opening to your ear canal. We refer to that structure as the external acoustic meatus. Acoustic, think sounds. Your ear detects sounds. External, because it's on the outside. All right, meatus is an opening. Then if you notice right behind your ear, and you can feel around behind your ear, you're going to feel a bump behind your ear. That's the mastoid process. It sits just behind the external acoustic meatus, a little bit below it. All right, so here is the temporal bone. Now this part should not be included. All right, because that is the zygomatic process, and that's not flat. So it's pretty much this part here is the squamous part of your temporal bone. All right, then you can see here's the whole temporal bone. Then you got the opening here, that's the external acoustic meatus. And then you've got this bone here, this little bump, and that's called the mastoid process. You can feel it on yourself right now. If you feel behind, all right, just go right below your ear, move back, you'll feel that bump back there. That's the mastoid process. Oh, there's so much I want to talk about, but I'm going to stop right here and let's do some labeling. I feel like we'll give you a break, rest our brains here a little bit. So if you have your atlas handy, let's take out the atlas. Whoops. Stop the share. Okay. Let's pull out the atlas here. And all right, let's do it. All righty. So we're going to start off with the skull here. We're going to go through some structures here, and then we'll call it quits for the night. All right. So again, I cannot remind you enough. Make sure, please, 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 to make this easier on yourselves when you're learning the skeleton, be able to identify all the bones first. Trust me, your life will be much easier that way. All right, so here's the frontal bone. All right, this is going to be the most anterior superior bone when we're looking at the anterior view here. And the flattened portion of this bone, all right, where your forehead is essentially, that's the frontal squama. So make sure you read the question pretty well, because if you look, the arrows for both of these slides are pointing to the same spot. So if the slide, all right, says nothing, I would put the frontal squama down. If it says bone question mark, then you'll say frontal bone. Try to be detailed. Look to make sure that there are no words on the slide asking for something specific. Too many times people have put the wrong thing down and didn't bother to read the slide. They just looked at the arrow, saw what it was pointing to, and then decided I'm just going to type in whatever it's pointing to. That's the frontal squama. All right, you'll notice on the lateral superior portion here, all right, of the orbit, we have the supraorbital margin. Supra means above the orbit. The supraorbital orbital margin. All right, you can see it right here on the model. It's these lateral portions here. Supraorbital margin. All right. Now, if you notice, you take a close look, the arrow's pointing at this little notch-like structure. It's not a complete hole in the bone, just like the bone got chipped. That's known as the supraorbital notch. You have one here and you've got one here. Now, not everybody has a notch, okay? Some people might have something else. So here you can see it. Here's a supraorbital notch. Here's another supraorbital notch. Now you'll notice over here, we have a little circular hole in the bone. That's not a notch. That's called something completely different. These are notches because it looks like there's just like a little bit of a chip out of the bone. That hole is called the supraorbital foramen. A foramen is a rounded passageway or hole in the bone. And in these notches and in these bones, we're going to have like blood vessels or nerves moving through. All right, that's the supraorbital foramen. All right, so let's take a peek at the parietal bone. This is one of two bones that make up the superior lateral portions of your skull. So this is what the parietal bone looks all by itself. Now you can see it in place on our skull. I like these skull models because they have different colors for the bone. So that's the parietal bone, that green bone there. And then you can see the parietal bone on this skull model. I prefer the colored skull models when we're trying to differentiate the bones more than these. All right, another bone of the skull is the occipital bone. It's the posterior bone and it makes up a good portion of the inferior part of your skull. So that's the occipital bone. Here you can see it on a posterior view. All right, we're going to talk about a couple structures here on the occipital bone. Here you can see on the lateral view. All right, now what we're seeing here is the occipital bone still, but what we've done is we're looking at it from the bottom, and you notice there's a big hole there. And a rounded hole or passageway in a bone is called a foramen. Well, this one's big. I mean, it's big. Okay, so we call it a foramen magnum. And this is where your spinal cord exits out of the skull to go down into your vertebral column. Foramen magnum. On either side of the foramen magnum, okay, now we're just zooming out and seeing the whole skull. On either side of the foramen magnum, all right, we have these rounded bumps. Okay, these rounded bumps, we're looking at it from the side, it looks like this. They're smooth. Okay, and so these rounded, smooth bumps, all right, we call those occipital condyles. And it's these occipital condyles that are going to articulate with the first vertebrae or the first bone of your neck. It's called the atlas or C1. We'll see that later on. Okay, the occipital condyles make a joint with that first bone. Here we'll zoom in a little bit and you can see they're lateral. They're on either side of the foramen magnum. Here on the posterior view, you can see there's that bump on the back of your head, the external occipital protuberance. My mom said that the bigger the bump is, the smarter you are. I don't know if I believe her. I guess we're always supposed to believe our moms though, right? All right. Here on the lateral view of the colored skull here, we can see the temporal bone. It's that brown bone. You can see all those structures there. We're going to go through these here in a moment. All right, that's the temporal bone. Here you can see it on this lateral view for this model. And then now you can see the temporal bone all by itself. So the arrow is pointing to the flat portion of the temporal bone. Of course, we call that the squamous part of the temporal bone. All right, so there's a couple other structures. This is the external view. This is what the temporal bone looks like from the outside. So what we just did is we flipped it over, and now we're looking at it from the inside. So the arrows there are pointing to the Petrous part, which is this part right here. All right, that's known as the Petrous part or Petrous portion of the temporal bone. Now, I'll give you a little bit better perspective here on the next slide. So we'll zoom out, and here you can see the Petrous part or Petrous portion of the temporal bone, this whole area here. Okay, that's basically where your ear canal runs, right inside that part of the temporal bone. Up front here, you can see some of the sinuses, all right, in your frontal bone. Thank God for sinuses, because if there wasn't sinuses present, all right, if it was solid bone, your skull would be a whole heck of a lot heavier. So sinuses help to humidify air, but they also make your skull lighter. And your neck thanks you for that. All right, back to the external view of the temporal bone. Here's that opening there to your ear canal. That's the external auditory meatus. So the next couple of structures are going to be around the external auditory meatus. Let's start with the one behind it. That's the mastoid process. Sits right behind the external auditory meatus, or a little bit inferior to it. Remember, a process is a bone projection. This one that's coming off from the bottom there, that's the styloid process, and it looks like a stylus, and that's why they called it that. If you've ever worked with a tablet and you got to use a little like a pen-like instrument, they call that a stylus. So we named this part of the bone the styloid process. And you have a muscle that attaches onto the styloid process. It's got a cool name, stylopharyngeus. You don't need to know that. All right, just anterior to the external auditory meatus is the mandibular fossa. Now, the mandibular fossa is a depression. Okay, it's a depression in the bone. So this mandibular fossa is going to form, right, with your mandible, your jaw, the temporal mandibular joint. I'll show you that here in a second. So that indentation or depression, it's the mandibular fossa. Now you can see the mandibular fossa with the mandible in place. And so that area there, or that joint there, forms the temporal mandibular joint. Here you can see it on this model. Okay, so this process, this bony projection that's coming off of the temporal bone, and this process is going to articulate with another bone, the zygomatic bone, and it's going to form the zygomatic arch. Well, the posterior part of the zygomatic arch, we call that the zygomatic process of the temporal bone. All right, so the first part of the name, we always name after whatever bone that the temporal bone articulates with. So the zygomatic process is named because it articulates with the zygomatic bone. And here you can see, all right, the zygomatic process, because it's hard to see, but this is where the temporal and the zygomatic bone articulate with one another. So to the left of that line, that's the zygomatic process. To the right of that line that I just drew, that will be the temporal process of the zygomatic bone. The whole thing, that whole arch-like structure, is the zygomatic arch. So if you're taking the test and you see a circle like that, it wants the zygomatic arch as the answer, because it wants the entire name of the arch. But if you see an arrow just pointing to one part of the arch, then it wants you to name the process. All right, now we're looking at the inferior view of the skull. Okay, and so you've noticed where I'm putting the X, that's the foramen magnum. Then on either side of the foramen magnum, we had these fellas, the occipital condyles. And if we keep going lateral, you'll see these openings there. And that's going to be called the jugular foramen. Remember, foramen is a rounded opening or passageway through the bone. And this is where the internal jugular vein forms and drains your skull, it drains the blood from your skull. So that's the jugular foramen. Now we're going to move anterior to the jugular foramen. You notice these arrows because here are the here's the jugular foramen here and over here. So anterior to the jugular foramen is another opening into the skull. That's called the carotid canal. And that is the area that the internal carotid artery enters into the skull. Veins leave, arteries enter. Okay, and so the internal carotid arteries, there's two of them, you have a left and a right one, they supply 80% of the blood to your brain. So those vessels are important. Quick review, zygomatic process. There's the zygomatic process on this model. There's the zygomatic arch. We should have all that. Okay, I'm going to stop here. It's a good place to stop. I think I've filled your brains in quite a bit. So